Levels of sodium fluoride accumulate in the pineal gland and cause its calcification and inhibits melatonin. We've seen these graphs earlier, and they create somewhat of an anomaly, where the DMFT values are decreasing very similarly in both fluoridated and non-fluoridated countries. So there are many factors operating to reduce carers, including diet. We've seen this graph before, and again, see the column on the right-hand side, countries which are unfluoridated, there's a decrease in DMFT values. Fluoride is not the only product. Most medications prescribed to lower blood pressure may reduce serum melatonin. For example, certain beta blockers will completely switch off melatonin and create sleep dysfunctional problems. An estimated 40% of individuals who take beta blockers have sleep disorders. This is just a very quick diagram here. The green is the pineal site. You have this very circuitous process of neurological signal going all the way around, and it activates the pineal site via these receptors, the beta-adrenergic receptor and the adrenergic receptor. Tryptophan is the starting material. It's an amino acid. It's converted to serotonin. Serotonin is the precursor for melatonin. You switch off tryptophan, as Roundup does, then you interfere with melatonin production. Propranolol, one of the beta blockers, you can see it has completely switched off melatonin production. Interestingly, marijuana is the most potent accelerator, inducer of melatonin. Over 200-fold, not to worry. Those fluoride lower IQ, we've heard the excellent presentations by Paul and Bill this morning, and there are two conflicting studies. The one in Dunedin last year said there was no significant difference. And I think the information presented by Bill is so compelling that I can't wait for the results to be published to show that fluoride in fact does impact upon IQ. Duty of care. According to the USA EPA, fluoride is a chemical with substantial evidence of developmental neurotoxicity. So beware, adopt the precautionary principle. Why subject our children to this ongoing fluoridation experiment to satisfy the political agenda of special interest groups, even if fluoridation reduces cavities, is brain health more important than tooth fluoride? Periodontitis is an inflammatory disease involving tissues of the gum margin. There are different classifications of periodontal disease. But what struck me was what we don't hear, a very strong association of periodontal disease in high fluoride water. Yes, we hear about the anticaries, but we don't hear about the fact that there's a strong association of periodontal disease with high fluoride water. And the authors have pointed out there's been no effort, appears to have been reported in the literature, to account for the increased periodontal disease in high fluoride areas. Why? We need to be aware of illogical correlations. More and more people drink milk, more and more people get cancer, therefore milk causes cancer. Coronary heart disease is more common in wealthier countries than in poorer, therefore wealth causes heart disease. Illogical correlations. We need to be aware of that. So we need to look further into this periodontitis and fluoride. Studies have shown that patients with periodontal disease have lower, significantly lower levels of melatonin. Is that an effect of high doses of fluoride suppressing melatonin? It's confirmed in another study. Periodontitis sufferers have a significantly lower melatonin level than healthy subjects. So the association becomes stronger. The inflammatory condition can be moderated by melatonin. Indeed, I understand melatonin is now given as a treatment for periodontitis. But also, secretory IgA antibody is important in binding to antigens and to the infectious organisms, involved in the periodontitis. Low levels of IgA are associated with low levels of melatonin. I'm not talking about genetic immune deficiency states. So the question is, what are the levels of secretory IgA like in patients with periodontitis? There's one study, the average value of IgA in saliva for periodontitis patients was significantly lower than in control group. Moving on very quickly and concluding. Melatonin has a very important role to play in the immune system. Roundup blocks melatonin by interfering with tryptophan. EMR can block melatonin if you're living close to certain towers. Sulfate is important in certain neurological diseases. Melatonin transports that sulfate into the brain. Here, heparan sulfate, that's not heparin sulfate, heparan sulfate is associated with low levels of heparan sulfate associated with autism. The sulfate is transferred with melatonin into the third ventricle. The sulfate's passed on to the heparin. If you don't have melatonin, you don't get the sulfate. If you don't get the sulfate, there's a risk of autism. Finishing off, we've heard that, we've read that before. Come back to the analogy. Fluoride, alone or in combination with other factors, can be a serious effect on health and well-being. Is medicine a science? Medicine is largely based on the sciences. It has not yet become a science. Medicine is replete with discarded therapies. There have been unnecessary delays in implementing measures. We've always heard in the past, stress causes ulcers. I mentioned earlier today, Semmelweis was sacked because he made an observation that dirty hands led to infections. In the 1940s, the medical profession actually advocated smoking Camel cigarettes. At a time also when tonsillectomies and adenoidectomies were common as part of mainstream medicine. Stephen Hawking, the greatest threat to knowledge is not ignorance, but the illusion of knowledge. Those who know not and know not that they know not are fools. The illusion of knowledge, many prominent leaders of the pro-water fluoridation movement have recently admitted publicly that they were wrong. This is consistent with some of the reports. Finally, the law is clear. Where there is a foreseeable and preventable risk of harm to your neighbour, the owner has a duty of care to remove that risk. And I rest my case.
Thanks, Ray. I like your talk. The fluoride that accumulates in the pineal gland and the decrease in melatonin, how many studies is that based on? Has it been repeated? Also, what's the mechanism whereby fluoride decreases melatonin production of the pineal gland?
As I understand, the mechanism is one of calcification of the actual pineal gland. As I understand, and Paul may be able to add more to this, that the mechanism is one of calcification of the pineal gland, rendering the pineal gland unable to switch on and produce melatonin.
And